Hello everybody, my name's Shelle Cowan. I'm an Aboriginal Specialist Trauma Counsellor. I work in private practice here in Grafton, and it's a pleasure that I've been asked to speak at this forum and hopefully share some of my experience and my knowledge. I'd just like to start today by doing an acknowledgement. So I'd like to acknowledge the ancestors of this beautiful land. I pay my respects to you and to all elders past and present, the then and now, and to the emerging elders of this nation and all other nations of this land. I would like to acknowledge all non-Aboriginal peoples here today and pay respects to your ancestors. I wish to welcome you all into my dreaming, my spirituality, and to hold you all safely without discrimination, without racism, and to honour your presence and mine as one mob, with a connection that is worth honouring with dignity and without denial of identity. I'd just like to share my screen now because I have a few slides here that I have worked out, and I'm not very technical, but I'm getting there. Just takes a couple of minutes for my screen to load. Aha. Domestic violence. Often I do presentations on transgenerational, intergenerational trauma, and I can talk about trauma till the cows come home, basically. Being asked to talk about domestic violence and the link to transgenerational, intergenerational trauma actually was a little bit more difficult for me to do. A lot of that is because it's extremely triggering through personal experience, what I want to share with you today as well. But there is so much domestic violence. It's almost accepted as the norm now. And what I have found is my workload has skyrocketed to like 1,000% more than what it was due to COVID-19, the effects of domestic violence, and all of that has just become so much worse. And people say, oh, is it because people are locked up and together? And I don't know if it's so much that as much as the fact that this COVID-19 business it's scary, and we're all starting to know people who have been affected by it. And so I really do think that the link to DV through the COVID-19 has a lot to do with our fear. So bear with me while I go through these slides. So domestic violence, is there a link to the cycle of violence and the cycle of inter and transgenerational trauma? Well, we need to unpack domestic violence. First of all, it's described as an incident or pattern of incidents of controlling, coercive, threatening, degrading and violent behaviour, including sexual violence, in the majority of cases by a partner or an ex-partner, but also by a family member or carer. It is very common. In the vast majority of cases, it is experienced by women and it is perpetrated by men. And it's often referred to as coercive control. Just a little bit more technical name, I suppose. So I just want to warn you that I'm actually about to share just a little tiny bit of personal experience with you. And I just wanted to warn you that this is a little bit triggering, and if you need to just take a little bit of time out and not listen to this, that's fine. It's only 2 slides, I think. And it's only a tiny little bit of my personal experience. My youngest memory of DV within my own family is from when I was 4 years old. My mother was working as a nurse at the local hospital and my father was an auto electrician. They also ran a local service station that used to be called the Golden Fleece. I do not ever remember a meal that my mother cooked for us as children, not ever, not from when I was born through to when I left home at 15. So never one. And this evening, it was my 4th birthday, and my father's mother had come up and she had cooked a meal for us, which in my family, that was like enormous. And for my birthday present. my grandparents had given me my very own little dinner set, which was a plate, cup and saucer, and I was just so happy. I loved it, and of course I'd unpacked it and I was using it for the very first time. And I can't remember what started the fight, but I do remember sitting at the table with my older brother and looking at my parents. And I actually remember I remember the feeling very well, and I was 4 years old. My grandmother came and sat next to me. She used to hug me a lot, and I loved my grandma because I was really upset. My mother was screaming at my father, and I remember crying, very much so. I would try and hide. Normally when they fought, I would either get between them or I'd run and hide. And I was sitting in my chair and I was up close to the table, so I couldn't move. And I remember my father trying to settle my mother down. My grandmother said nothing. Of course, when you go back 56 years ago, it was not her place to say anything either. Then my mother picked up a knife and she slammed it down on the table. And of course, it flicked back up and over and it landed on my brand new plate, breaking it. And it broke into 4 pieces. My mother then picked up a piece of my plate and threw it at my father. It hit him right in the corner of his eye and lodged into his skin. And of course, blood went over everything. And like I said, this is 56 years ago. This is very, very triggering for me. I never share this, but I particularly wanted to share this because it's actual personal experience. So when we talk about trauma and we talk about sexual abuse and all of the rest, I particularly wanted to really put out there that how much domestic violence actually affects young children. And I don't tell you this to make you feel sad or sorry for me, because I don't need that. I'm really, really a long way on my road to recovery, and I cope with it okay. Yes, I get triggered, but that's okay too, because I know when I'm triggered. So I just wanted to show that even at that tiny little age, I remember it like it was yesterday, and it happened 56 years ago, and I can still smell and feel and hear the experience. So, and that's from somebody who really understands how trauma works in the brain. Every year, so many children suffer the effects of abusive or violent events, and that change the way our brains develop and result in lifetime symptoms of distress and trauma. These symptoms often manifest into behaviours and negative coping issues such as drugs and alcohol. But we know that there's many, many other coping issues as well. We know that the other symptoms such as eating disorder, personality, mood disorders, anxiety, depression, relationship and attachment issues, and of course violent and or abusive behaviours are all other symptoms of domestic violence. So children of all ages are affected when they are exposed to violence, and I've sort of done a little rough up on ages and how we deal with this and how it presents itself. So a lot of people believe that if you're pregnant, the child cannot be affected by domestic violence. We know that that is not true. So in utero, an unborn child may be injured from the womb due to violence. They may suffer exposure to drugs or alcohol, and that mum might use that to cope with her stress, fear and the violence. And she may not even realise that it is affecting her baby. So babies that are born or that have been exposed to violence will often have difficulty developing attachments with their parents and caregivers, and often suffer from failure to thrive. So we also know that babies born to parents that have been in really serious DV situations, they don't sleep well, they don't feed well, and of course mum is already so stressed that it becomes even more of an issue. And through to a toddler, a preschooler's development may be affected. They can suffer from eating and sleep disturbances, as well as a lack of understanding or respect for other children. And often this results in biting, punching, kicking and pushing, along with many other displayed behaviours. So the expected behaviours, babies and young children may display aggressive behaviours. They might throw almighty tantrums. And I'm sure everyone can relate to that. This is often mistaken for behavioural issues that need to be labelled, such as ADHD or ADD or ODD, etc. So many parents may have an idea that the child is showing behaviours associated with the situation of violence, but will not speak up for fear of having their child or children removed. It is a shame factor as well, especially for us Aboriginal people, to speak up about our baby daddies. We've got to be very careful. Parents often are referred to paediatricians or GPs, where the child will be placed on strong medications such as Ritalin. We know that this will interfere with the way the child's brain processes information and the way it develops, and yet it does nothing to help with the trauma bubbles that are swimming in the brain, waiting to react to the next threat. Children to teenagers. A school-age child may struggle with peer relationships, academic performance, and emotional stability. At this age, children start to display bullying behaviours, or they may start to shut down and not make friends easily. Teachers often notice these children sitting alone in the playground. They often have trouble concentrating and may seem to be withdrawn. Teenagers, when exposed to violence that may have happened years ago, or the violence may still be continuing today, our teenagers will display some extreme negative reactions. These young people may suffer mood disturbances, severe emotional dysregulation that often leads to suicide ideation. When this happens, young people tend to isolate themselves. So where does the blame sit? Teenagers and children learn to blame themselves for the violence in their lives. This is noted from personal experience as well. Children very rarely grow up hating their parents and often end up feeling more protective of them, both for the perpetrator to protect them from going to jail and the victim because of the physical injuries. This leaves our children nowhere else to lay the blame. So they blame themselves for not being able to change the way their life is and make it better for everyone. And this is compounded when there are younger siblings that need to be protected. This is the reason often that young children are removed, young people are removed from both parents, and it creates an even bigger trauma bubble and greater negative behaviours because they are now completely unable to protect their parents. They feel right out of control. We now have enormous trauma issues, and understanding how to work with this becomes very difficult. These children and young people suffer emotional distress at levels that we as adults find hard to understand. Yet we expect them to behave, attend school, and be nice to other people. The only way they know how to regulate their emotions is through the violence that they have witnessed and how they reacted to it then. These young people are at chronic risk of suicide and self-harm, remembering that suicide is a protective factor that helps to control the pain we feel. Further to this, domestic violence is the #1 reason that young people leave home, resulting in so many homeless children and rough sleepers due to not being able to go home for fear of being targeted. So where is that link? Well, the link is like any other trauma, be it intergenerational, where it happens from one generation to the next, or transgenerational, parenting through one's own trauma. And of course, epigenetics, part of the transmission of stress to further generations, making the children more susceptible to PTSD. Epigenetics means that experience can switch genes on and off, and so trauma effects may be passed down through the DNA to further generations. Epigenetics is only relatively new, and there's lots and lots of studies going on about it, and it's all about the protein wrap of our DNA. We as adults struggle to work out our own behaviours and feelings. We find it very confusing to understand why we have been abused in any form. Often we become so preoccupied in our own trauma that we turn off. We become unattached and avoidant of all contact and feelings, therefore not able to be present or emotionally available for our children. The more trauma we have suffered and the greater the epigenetic effect, the more difficult it becomes. So I've done up my own trauma bubble. Of course, any of you who have attended any of my forums before have probably seen this. But this is just a little bit of the single trauma and often how that goes out into complex and accumulative trauma, and of course child abuse, family violence, all of that just radiates out into collective and systemic trauma, which of course us Aboriginal people have as well. And then of course we have the ongoing intergenerational trauma effects too, with from one generation to the next. And when we look at that, there is no trauma there in any of those bubbles that would be easy to deal with. So continuing the trauma trails, perpetrators of domestic and family violence are far more likely to also perpetrate direct forms of child abuse and engage in negative parenting practices, which they often don't even realise. The children in their care are also more likely to experience multiple additional adversaries, such as exposure to other forms of physical, sexual, and emotional violence and abuse in the home, at school, and in the community. And this is often a result of displayed behaviours and isolation. There's more. A child's exposure to domestic and family violence at any age may result in a range of poor psychological, behavioural and physical outcomes, including depression, anxiety, trauma symptoms, increased aggression, antisocial behaviour, temperament and mood problems, impaired cognitive functioning, learning and schooling difficulties, low self-esteem, pervasive fear, peer conflict, loneliness, increased likelihood of alcohol or substance misuse, and vulnerability to unemployment and homelessness. That's certainly a whole lot more. And then there's this. It is also possible that domestic and family violence exposed children may, as adults, exhibit attitudes and behaviours that reflect their childhood experiences. Now, when I say this, and I'm sure you're all very well aware, just because someone has lived through domestic violence from their parents or caregivers does not mean that they're going to do this as they get older, and especially once they become parents themselves. In actual fact, a lot of the what I experience and what I see in a lot of my clients is that because they live through it, they don't want that for their children. So they're very careful, but because it's such a normal way of living, and it's something that connects really well with us because we know how to deal with this. We seem to put ourselves in situations where this thing continues, and that's why we see such a cycle of domestic violence. And we also see women who put themselves in the situation and they leave that situation often for a worse situation. And it is really, really difficult. In my experience, it was my mother who was the perpetrator. And when you have that situation, it is really, really hard for men to come forward. And I see it even today where men go to court because of the domestic violence put onto him by a woman who has turned it around that it's him hurting her. It is very frustrating. We need to look at this. So when we look at untangling ourselves so that we don't continue the trauma trails and pass it on to our children, what can we do to untangle from transgenerational trauma? It can be a long and complicated process, and it can be, but it may not be either. People often have the mistaken thought that seeing a counsellor means having to talk about all the crap that has happened in their life, and that is really frightening. So this creates more shame, and often people have worked so hard to pull themselves out of that dark place that even the thought of going back there and speaking about it is very scary. I believe that working with an experienced counsellor does make the world of difference. I think that lived experience cannot be beaten. So someone who understands without having to answer to, and how did that make you feel? So understanding ourselves, understanding what is a learned behaviour, a protective behaviour, and a trauma behaviour response can help adults and young people to understand that the reactions they are experiencing are actually quite normal for what they've been through. Helping young people to recognise that they are an individual that is unique and growing into their own self and their own beliefs can set them apart from learned behaviours. And more. This in turn helps to change the belief of it is my fault to this happened to me, which takes away the self-blame. And helping to understand the inherited trauma helps people to recognise the negative behaviour patterns associated with this trauma. Okay, so where do we start? One of the questions I really like to ask my clients is, how could you have prevented this from happening? If you're 4 or 5 years old, or 8 or 9 years old, or 12 or 13 years old, how could you be held responsible for what your parents are doing? How could you have stopped it? And you know, that always stop and think, because that is a really, really, really difficult question for someone to actually think about. And a lot of the times they don't think about it. But when you ask that question, that is the start on how we work through the trauma. So working with it, what types of therapy help with transgenerational trauma, and especially when we look at trauma associated with domestic violence. So often I find my clients not only have PTSD, but they have complex PTSD, because this is created when severe repetitive abuse happens over a long time in someone's life. And it occurs when people are at their most vulnerable, such as early childhood or teenage years. And it does create lifelong challenges and maladaptive coping strategies. And this is an absolute when young children are exposed to DV within the family environment. We know that children exposed to DV when they are very young is very similar to the trauma of our war veterans. So there is no single modality that works with every person, but I do find that CBT, cognitive-based therapy, appears to be one of the most workable. This, along with building a sound, trusting, transparent and honest relationship with the client, where safety, understanding and belief is paramount. Working with domestic violence, it's very, very similar, I think, to case management. It's never about just one part of the violence that they have suffered. It's multiple, and there is multiple facets to that exposure of that trauma, especially when we're trying to help parents, in particular mums, work through their own trauma of physical assault and psychological assault, and then the guilt and the shame that comes with parenting through that and watching their children, you know, suffer. It's very, very difficult. So making sense of children's perceptions. We have known for years now that the effects of DV on children have huge consequences for them growing into adulthood. And yet, however, there remains very little advancement in helping children to voice their experiences of DV, through their eyes and voices as, as children or as adults. Children perceive their own ideas about DV and how to respond. It could be the bruises or the damage in the house, but it is their way of how to process these thoughts. I very much err on the side of caution when counselling young children. I am so aware of creating more trauma bubbles by making the perceptions real and therefore not able to make sense. I work with mums and or dads to help them re-establish safety and attachments that are safe and secure. I want to leave this with you. Be careful to not punish trauma behaviours. Understand and recognise that young people are going to act out. Young people need safe places, safe people, and they need purpose. Children and young people should not be isolated. Do they really need suspension from school, or is this further isolation? All children and young people need boundaries. When they scream at you, should you take that personally? And finally, remember, if you are a safe person for a young person, it is likely you will get yelled at often. This is actually not directed at you, but at themselves. If a young person trusts you, then they trust that you will be there no matter what. If you take their screaming personally, you will walk away. Often what a young person is screaming at you is actually how they feel about themselves. You may as well be holding up a mirror for them to scream into, looking at themselves. But they will expect you to walk away or react back, because so often they hate themselves and want you to hate them too, because they believe they are not worth loving. So just take a step back, just reassess the moment, just reassure it's okay when things settle, just recognise the depth of pain from where the action is coming from, just let it rest. Don't take it personally. Just help to co-regulate. Your emotional regulation will flow through to the young person, helping them to regulate their emotional state. And remember to just be in the moment. It will be okay. And that's it from me. So Steph has my email, and if you would like to email me any questions, perhaps you could email Steph, and Steph will get back to me, or Tiv. Either way, I will just come back to sharing my screen so I can, so you can all see me. IT is not my my forte, not by any standards. So I think that is correct. I think I am back. So yes, so thank you very much, and I hope that you really enjoy or learn as much as you can from the rest of the forum. I know that I'll be joining the rest and seeing what we're all getting together and how we're helping people, and I look forward to it. So thank you very, very much. Thanks, Steph.